will be recording tonight's video so that it is available after the call ends. We'll get it posted to our YouTube channel within about 24 hours. So if you know anyone that might be interested, you can absolutely share this with them. And I will quickly share a disclaimer for tonight. So this call is for Tuesday, March 15th, 2022. This video discusses matters related to residents of long-term care homes operated by Grey County during the COVID-19 pandemic. Please feel free to share this video with others in the community. If you have a family member in a long-term care home not operated by Grey County, please contact that home if you have questions or concerns about their care. And the last thing I will just touch on tonight is our format. We'll be following the same process as usual, where Jennifer will provide a quick update. For those of you on the call on Zoom, on your computer or tablet, you can use the Q&A feature on there to submit a question, and we will get to those at the after Jen's update. Please do try to use the Q&A feature if it's working for you. It does help us make sure that we don't miss any questions. We will get to as many as we can, and we're hoping to wrap up by 8 o'clock tonight. So I think that is it for me with the logistics. So I will pass it over to you, Jennifer.
Great, thanks, Rob. Thanks for joining us tonight. One of our first nights of daylight still. It's the silver lining of losing an hour on the weekend. All parents everywhere are still struggling to keep their kids on a schedule. Anyway, thanks for joining us, and I will hop right into the update. So we met last virtually on February 10th. The purpose of our call tonight is to provide an update on the changes released by the Ministry of Long-Term Care on March the 9th. Since we last met, we've seen all 3 homes manage both COVID and respiratory outbreaks. We saw the end of the COVID outbreak at Rockwood Terrace and an overall decline in outbreaks in long-term care across the province. In February, at the peak of the wave, over half of the 600 long-term care homes in the province were in COVID outbreak. Today, there are about 45 homes in outbreak in Ontario. Locally, there are 4 homes in outbreak, and if all goes well, the seasonal coronavirus outbreak at Lee Manor will be declared over this week. The Ministry of Long-Term Care released updated directives for us on March the 9th titled Living with and Managing COVID-19, with updates that focused on shifting from requirements and mandates to a guidance-based approach and an employer-driven immunization policy, updating the testing directive to reflect the latest advice of public health experts, and adjusting measures related to visitors, resident absences, and resident cohorting. In this update, I'll touch on vaccination requirements, surveillance testing and PPE, the gradual easing of restrictions, and touch on outbreak protocols compared to eased restrictions. So, vaccination requirements. The vaccination program has been very successful in protecting the most vulnerable people in our communities, and specifically, we've seen the positive impact of vaccinations in long-term care homes. We are grateful to everyone who's participated in this important opportunity. Making the choice to be vaccinated has played a crucial part in keeping our residents, families, and team members safe. The Ministry of Long-Term Care update of March 9th states that long-term care homes as employers retain their ability to mandate vaccination requirements for existing and new staff, students, caregivers, and volunteers. The County of Grey 3 long-term care homes will continue with our current immunization policy that requires proof of 3rd dose of COVID-19 vaccination or proof of valid medical exemption for all staff, students, support workers, volunteers, and designated care partners. When we reflect on the devastation and tragedy that happened in long-term care across the province at the beginning of the pandemic, we can see the significant impact that vaccine has had in this population of people. Many of our residents have had their 4th dose of vaccine, and others are getting theirs as they become eligible. We will continue to offer vaccine on site at each long-term care home to support any team member or designated care partner who would like to get one, and we encourage you to do so. Surveillance testing and PPE. Surveillance testing will continue when visiting indoors. Effective yesterday, there were some changes that I'd like to highlight. Surveillance testing will no longer be required for outdoor visits. Visitors who will be traveling with a resident in a vehicle are required to have a rapid test prior to the outing. This isn't new. We've been doing this for, since February 10th, so that will continue. Active screening continues for all people entering a long-term care home, so there'll still be a screener greeting you at the door and asking you the series of questions. Our 3 homes will continue with daily rapid antigen testing for all staff, students, support workers, volunteers, designated care partners, and general visitors. If you have had a confirmed COVID-19 infection, you will be required to resume rapid antigen testing 90 days after you had COVID-19. That is new. It was previously 30 days after, so that's been broadened to 90 days. Use of appropriate PPE and masking for individuals working or visiting a long-term care home continues. Currently, we are using universal N95 masks and eye protection in all 3 of the homes, and it's required that they are worn at all times. Starting March 21st, the PPE policy will be updated to reflect the use of surgical masks as a minimum requirement. So team members, students, designated care partners will be able to choose the level of mask that they are most comfortable with in a variety of situations. If you prefer to wear an N95 mask, we will continue to provide that. Universal eye protection will also be de-escalated on March 21st, but will continue to be available for anyone wishing to use it. Further easing of temporary measures, so effective yesterday, all general visitors, including children under the age of 5, can resume visits. Indoor visitors must have 2 COVID-19 vaccines, with the exception of children under 5, as they are not yet eligible for vaccination. We have ordered child size N95 masks to support best fit for children when they're visiting. The maximum number of general visitors has increased to 4, that's including the DCPs, and there is no longer a limit on outdoor visiting. All residents may go on overnight absences. The testing of residents returning will continue until further notice. To arrange a social outing, please contact the home and speak to the registered nurse or the RFSM. So that would be Elena, Terry, or Kim, depending on the home. As we have previously required, we will, when you phone, we'll talk about what are the plans, we'll assist with a risk assessment, and we'll help support work out the details for the overnight outing. A reminder, I've mentioned this already, that anyone who will be in the vehicle with a resident is required to do a rapid test at the home prior to the outing. And I will just note that the rapid testing has proven to be really important in identifying people that have COVID-19 without any symptoms. And as recently as the last 10 days, this screening did prevent a resident from riding in a vehicle with someone who didn't even know that they had COVID-19. So we feel it's really worthwhile continuing that. Masks are to be worn at all times. And when we're talking with you about the outing, we'll remind you about the public health measures that are in place. So masking, hand washing, and distancing. Cohorting will no longer be required for social activities within the home, but must be maintained for dining. And social group activities can be increased in size, but continue to require physical distancing. I will add that for our 3 homes, we are currently looking at strategies to support unvaccinated general visitors to be able to visit indoors. What we're looking at is that that will be arranged through pre-scheduled visits in a designated space. These visiting stations will be available on March 21st. Unvaccinated general visitors will be required to be actively screened, undergo surveillance testing, and wear a best-fitting N95 mask and follow distancing and hand hygiene protocols. Of course, outdoor visits continue to be an option and will become better as the weather gets nicer. Window visits and virtual visits will also continue to be available. And that is the update. That's really the key areas that I wanted to highlight. It is a significant change in terms of more people being able to come into the home, which is really nice for the residents. And we really just want to balance the increased risk with the increased opportunity for residents to see people that they love and that they want to see. So we're turning down the dial. The language we've been using is de-escalating restrictions, while at the same time having enough in place to keep everybody safe. And so we can go to some questions.
All right, thank you for breezing through that update, Jen. There was a lot in there, so I suspect we will get a few questions. So again, if you have anything, just put them in the Q&A and we will get to as many as we can. So the first question here is, can we now wander around the unit and nursing home with our loved one, or are we expected to stay in the room?
Yeah, no, so you can wander around the unit or the home area. I do, though, encourage you to do your own risk assessment. So this is going to be different for everybody. Some people are going to feel more comfortable visiting with their loved one in their room, just them, and they have a bit more control of who they might run into, and or they won't run into anyone. So do your own risk assessment, but do keep in mind the distancing. The public health measures are still in place. So I think we're going to have to just be cautious for the next few weeks while we figure out how to live with and manage COVID-19 in a way that we haven't been for the last 2 years. So I'm a little bit risk averse, which is crazy. I can't even believe I'm saying that, but I'm a bit risk averse and I didn't even work on the ground during the outbreaks, but supporting the team members that were working during the outbreaks. We just want to avoid that as much as we can, not to mention the isolation that is required for residents. We really just want to avoid that. So that was a very long answer for yes, you can take a walk around the home area and just be careful and respect people's distance and space.
Great, thank you. Jennifer or Dana, could you just explain in more detail what we mean when we say cohorting residents together?
I can jump in there. A cohort is a group. So we were trying, particularly at the peak, and as a strategy for infection prevention and control, is to cohort groups. So if there was someone that tested positive, instead of it impacting the entire home and the whole community, we were cohorting to particular groups, so smaller sizes. So, it may have been a unit or a floor. So we did activities as a cohort or as a group, and to contain some of those, if we did music sessions, we may have done the music session for a second floor or for a particular unit and brought everybody together. And now with cohorting, we're allowed to expand those broader groups, with the exception of dining. So we're allowed to do a little bit more mingling in a safe way. And so we don't have to stay within our cohort or our group.
Okay, thank you for that, Dana. That's great. So this question, I'm not sure which home this is regarding, but after the 21st, will church services be blended with the second floor, and can family attend the services?
So I'm going to say that yes, that will be the plan. Whether it will happen the week of the 21st, I'm not certain. We are getting used to the new protections, the new de-escalation state, but so are our partners and our colleagues that we work with that provide church services. And so some of it will depend too on the comfort level of those groups and whether they're starting back in the same way right away, or whether they're taking a graduated approach as well. And yes, family should be able to join. We will be keeping an eye on space so that we don't have people kind of all jammed into a small space with not a lot of distancing allowed. So we are going to work to manage that.
Thank you. So there's a couple questions here regarding the unvaccinated general visitors. Maybe Jen, could you go over again what the intention is for how we're going to safely permit the unvaccinated general visits?
Sure, and I'm glad that these questions are coming up, and this hasn't been an easy week actually, and last week in trying to process the changes and figure out how to balance that safety, but also not limiting residents' access to people that they've really been restricted from, off and on during the last 2 years. So we did some surveys informally with our colleagues across the province to see what they're doing in their organizations in terms of supporting people that don't have their vaccinations, and it was really kind of all over the board. So some long-term care homes are sticking with their current state, where if people are unvaccinated, they have to meet outside or outside of the home, and others are doing what we're doing and looking at a way to support it in a safe way inside, knowing that it's March and the weather isn't particularly fabulous for having outdoor visits. So what we're doing is, starting March 21st, we are dusting off the booking tool. So many of you are familiar with the booking tool. We use it to schedule indoor visits and outdoor visits and virtual visits earlier in the pandemic. And so individuals who are unvaccinated or are not wishing to disclose their vaccination status can schedule a visit. It will be in a designated space. So it's pre-scheduled in a designated space. They will need to rapid test just like everyone else, and we will provide best fitting N95 mask for them for the visit. I will say though, I saw one of the other questions about, will they be in residence rooms? And for the most part, people will be visiting in the designated space. But there may be times when someone that is not vaccinated or doesn't wish to disclose their status is in the resident room. And that's, it's really based on the resident's needs. So throughout the pandemic, there has always been an ability to support residents in a critical situation. So either end of life, very critically ill, perhaps really struggling with a new move-in, and we've been able to support people safely coming in to support that resident. And for example, in the case of end of life, not everyone is vaccinated, but we did not exclude them from being able to come in and be at the bedside of someone that they love in that situation. And so I just bring that up to remind everyone that we have done that safely and successfully over the last 2 years. It's organized, it's well thought out and prepared in collaboration with the clinical team. So it's not just kind of willy-nilly, but it's really important to us that the residents have the things that they need and the support that they need in the different situations that they might be going through.
Absolutely, and I believe that you had said as well, Jen, that general visitors who don't disclose or who are unvaccinated will be wearing the N95 masks as well, and they'll be well-fitting.
That's right.
When they're moving through the home.
And if I may add, we're also putting a HEPA filter in that area for all of the visiting areas, and other IPAC measures ensuring disinfection between visits, well-ventilated space, and good hand hygiene. So all of those IPAC practices for those unvaccinated visits we'll be sure to support at each of the care communities.
Could you just explain what you mean when you say the HEPA filters, Dana?
Okay, well, I'm no HEPA filter expert.
Sure.
Actually, Public Health is hosting an event we're attending this week to learn about HEPA filters, but what that is about air exchange. So we want to make sure that we're continuously supporting the air exchange, and the Ministry of Long-Term Care provided each of the care communities with a number of HEPA filters, and through the various outbreaks, we strategically place these HEPA filters in places where groups gather. And that, whether that be in a dining room, in a staff lounge, or particular locations, but it is intended to clean the air and to ensure that the appropriate air exchanges are happening. But it's an ability to filter out any pathogens, or most pathogens, based on the HEPA filtration rate we have. So again, I'll know more about HEPA filters at the end of this week. But we are supported with that being one good IPAC strategy.
Yes, always good to have more tools in the tool belt, for sure. Jen, could you maybe just remind us when the rapid tests will be required again?
Sure. And so this isn't changing from the current practice right now. So right now it's every shift, every visit. People are required to do a rapid antigen test, with the exception, and so this number is starting to increase as the numbers around us, the case numbers go up. If you have had COVID-19, a confirmed case of COVID-19, you won't be required to rapid test for 90 days.
Thank you. Will children 5 and under be allowed to visit in the residence rooms?
Yes, we talked about this one a lot too, and prior to March 9th, we knew that this was coming. This had been on a previous release of the easing of restrictions, and so that didn't actually change on March 9th. And we were preparing to allow children to be able to visit in the residence rooms, and so we're going to continue with that. As anything, if it doesn't go well, then we'll reevaluate and reassess and try a different way. But again, the residents, there's some residents that haven't had a chance to see their loved ones that are under 5 for quite some time, other than through a window or virtually. And this was really important to the residents. And so we wanted to be able to support that. And so we have placed an order of N90 child size N95 masks, and those should be in soon. In the meantime, use a best fitting, whatever masks that are at the screening station. And there's usually 2 or 3 different options, and that's what's available right now. But we have ordered about 1,000 child size masks to distribute across the 3 sites.
Okay, great. If you need a source for masks with dinosaurs on them, I can definitely hook you up, because those have been very popular in my home.
Keep that in mind.
Okay. If you visit with your loved one outside, can you join them in eating a meal or a snack or anything at this point?
I'm going to defer to Dana. I saw that question coming up, and I'm not sure. I don't know the answer to that.
Well, I think, in Jen, we talked about in the home. So in the home, families are welcome to join. If they're vaccinated, they're welcome to join their loved one during a meal time, but they must be masked. And so that's inside. And in this terms of this question, it's outdoors. And so that is a lower risk to be outdoors. So we would encourage, if you decide that you're headed outdoors, you maybe brought a coffee and something to snack on, to really try to, good hand hygiene, socially distance as you can, take that moment, have your coffee and mask or what have you. It is a lower risk. We also recognize that people can head out. So those same public health principles, we want to encourage that they're happening, but outdoor, if you are visiting, that is in terms of lower risk, that is lower risk, but again, hand hygiene, remove mask, physically distance if possible. But it's one of those things that we just want to make sure all the principles in place. But yeah, if you're headed to a restaurant, you take your loved one out to a restaurant, that will be happening as well. But we are in a congregate setting. We do have the ministry guidelines indoors not to, and we just really want everyone to do their very best to be mindful of those principles and manage them as best as we can.
Thank you. How many positive tests of COVID were detected in vaccinated versus unvaccinated during the, I'll say the latest wave, December to present date at your long-term care homes? Is that data that we would have openly available, or maybe it's better to just speak to our vaccination rate?
Yeah, I don't have a number. And I think that's data that is accessible through public health websites or Ministry of Health websites. But we are doing our rapid testing on all staff and all designated care partners that are coming into the home. And all of those folks are required to be vaccinated and boosted by a date. So if we're identifying COVID-19 through that process, it's identifying it in someone that is vaccinated.
Okay, thank you. Will cohorting for social activities be by floor, or will residents be able to enjoy social activities in common areas of the home?
Yeah, we're heading to the common areas in smaller groups. We're taking it easy, making sure that people can be distanced, but we are headed towards that kind of more normal activity grouping.
I apologize, Jane. I see you had a follow-up question to the earlier one regarding rapid testing. Why, if you are positive, would you not need to require antigen testing for that period of time?
I'm going to defer to Dana on why there's that 30-day, but now 90-day wait before it starts again.
Right. I think in terms of, and when we started, and it was quite interesting, when people would test positive with the PCR test, and then we had to wait the 30 days. If the odd person got swabbed before that, because their timing, and we've had cases where it tested positive, it continued to test positive. So there is a tendency that you're continuing to shed that virus, and it may detect in that rapid antigen. It is looking for the antigen, not the virus. So you may still have antigens, and that's why it may detect it. So as we've evolved throughout this pandemic, they've identified areas to up to 90 days now with the rapid antigen. And there's also a level of protection, so to speak, that natural immunity that they're recognizing that you're at lower risk. So between those two variables, they deemed, and most recently this update, 90 days that you don't need to antigen test. It used to be 90 days for PCR and 30 days for rapid antigen, but now it's 90 days as we know more and we test more and get the science. But that is why. So it might give us a false positive, and also recognizes that you still have some protection.
Okay, thank you for that explanation. Right. If I take a resident out for an appointment, will she be rapid tested upon re-entry to the home, or PCR tested a few days later?
Yeah, I'm going to defer to Dana too. It's both, but
Yeah.
there's
So
a bit of a delay, right?
Yes, we have our directors of care. We've got this log to help us. Clearly, this is a strategy to identify an early detection, and so it really depends on the appointment. But we are, if it's a routine appointment, for example, some of our residents who go to dialysis regularly or have appointments, whether it be physio outside of our home, there's a routine test that the ministry requests twice a week. If there's other appointments. So it will depend. So connect with your director of care to talk a little bit about it. But yes, we will be doing both rapid antigen and or PCR depending upon the circumstances. So there will be some follow-up testing. Another approach to early surveillance so we can identify anything, particularly with the community spread of COVID still happening.
Okay, thank you. If someone wanted to provide a simple mani-pedi service, what steps would they be required to take, and who would be a good contact?
It's a good question. I would suggest you contact the resident family services manager at the home. So that would be Terry at Rockwood, Elena at Lee Manor, and Kim at Great Gables. And I think that they'd help get you in the right direction.
And I'd be remiss if I didn't suggest that we, depending upon who you are having to come in for a mani or pedi, to ensure that they are inspected and that they're using the tools that have been to ensure we don't have any disease transmission. And public health does have a personal service setting list where they identify who's been inspected. So always good, just another infection prevention and control option.
Thank you. Who do we connect with when DCPs can get their 4th booster?
No, that's a great question. So that there hasn't been an update released about 4th boosters for, as far as I know, for any other part of the population that hasn't already been identified. So fourth boosters definitely available for residents in congregate settings, so long-term care, retirement home, individuals, I think over a certain age, and with vulnerable circumstances. So Dana, do you have any other information about that?
Yeah, so obviously fourth doses have been talked about, but if you are of that population, are you immunocompromised? Are you hitting some of those indicators? And maybe what I can do is when we send out this notice, I find a snippet to be able to add as our follow-up in terms of who meets that criteria. At the present time, we don't have a sort of a general release for 4th doses for anyone at this time, except those within that criteria in our residents. So I'll see there's a bullet point I'm thinking of, and I'll snip it and send it along.
Okay, thank you. All right, we have one more question here. So if you do have more, please do put them in the Q&A, and we'll certainly get to a few more here. And this one is one that a question I have had myself that I am looking forward to the answer to if you have one. How do you provide that you have had proof of COVID-19 if you are testing at home only?
Want me to jump in there, Jen?
I do.
Yeah. So if you've, especially if you're if you're a general visitor of our long-term care homes, if you're a family member, DCP, if you visited our home and you don't feel well, we want you to give us a call. We can do a PCR. You're entitled as part of our care community, people who've connected with our home. You are eligible for a PCR. So if you've done a rapid antigen test at home and it tested positive, we do want to encourage you to call and to get a confirmatory PCR, and we can get that done. And then clearly you're going to have the date, the 10 days, because you do need to be away from the care community for 10 days, either from the time of your symptoms and or your confirmed test. So we do encourage you to come and get a confirmatory PCR. And if you're not well, if you visited on Monday and you weren't well on Wednesday, please connect with the home and we can get that testing happening.
Right.
Dana, how are people proving or demonstrating that they've had COVID-19 in, say, the last 90 days that would then exclude them from rapid antigen testing?
We at the present time, because so many were not entitled at that point to get a PCR. But at this point, we'll have a discussion. We'll take a look at that. We may have to double check, and if in doubt, we may swab again. As we take a look if timing is there. But ideally, if you were test positive, we would get that lab result. And I'd be remiss not to also flag that maybe you can't come to our care community, maybe you're out of the jurisdiction, but assessment centers, if you say you are connected to a care community, will also you're eligible for swab in an assessment center as well. And then you would be able to have proof of your test at that time as well. There are going to be some of those, Jen, where we won't have it exact as we're working through this, particularly the 90 days. But we're going to do our very best, and we'll work with all of the families to try and figure it out and do our very best.
Yeah, okay, that's good. And so we'll connect back with the teams and just see how that's, I mean, this is only just started, right? The introduction of general visitors. So I'm going to remind myself and all of us that people coming into the home and have the best of intentions. They're coming to see the people that they love, and I know that to be true based on the last 2 years and how successful we've been together in managing to contain COVID-19 as best we can. So we'll check in with the screeners and see how it's going. There will be some of you that have had COVID-19 and had, or you suspect that you did, but had no opportunity to be able to do a test to confirm it. So I think that you will disclose that at the screening, and we still provide rapid antigen, or no, you won't be tested, but you'll do your screening. We have the various source control materials there, so you could choose N95 or surgical mask. There's eye protection. So there are things that we can do to support the visit in a safe way. And that was a long way of getting to, we're going to take people's word for it while we work through the process, because there's going to be a period of time where you won't have proof that you had COVID-19. So I think we'll just believe you. And we have other things in place to keep people safe, and we'll carry on. Oh, you're muted, Rob.
Sorry, I think that does answer the follow-up that just came through there as well. Okay, so I don't see any more questions in here right now. So I think, I guess we'll wrap it up early tonight. It was a little bit of a smaller turnout, but we'll certainly circulate our follow-up email after the meeting and get the recording on there. If there were any questions that come to you after the fact or that we didn't get to tonight, if we did happen to miss something, please do just reply to that email or email communications@grey.ca, and I'll make sure that Jen or Dena is able to respond to your question. And is there anything else that you wanted to end on tonight, Jen?
Sure, I had something put together, but really this is a challenging time for everybody. Some people are so happy to throw the masks off and get back to life in the way that they've been wishing to for 2 years. And some people are really still, a bit cautious and nervous and neither of those is wrong. So I just ask that we all approach each other with kindness, and that's really how we'll get through. And this won't be forever. This is another step in moving our way through this pandemic, and we'll get there. So thanks very much for joining and for your engaging questions, and we'll see you soon.
Okay, thank you. Good night, everyone.